Thank you for joining us for this special webinar series highlighting the new 2014 research grants funded by the AKC Canine Health Foundation. In all, 17 grants were approved, totaling nearly $1.5 million for canine health research. These projects cover 10 unique areas of canine health. In each of the short videos in this series, CHF's Chief Scientific Officer, Dr. Shila Nordone, explains the proposed work, significance, and impact for each grant, and how these projects will work together to move canine health forward so that all dogs can live longer, healthier lives. We hope you find these webinars to be informative and exciting. Please visit www.akcchf.org/donate to show your support for our funded research. In this session, Sheila will be discussing our new grants within the Behavior Research Program area.
This was the first year that the AKC Canine Health Foundation asked for behavior grants specifically. And we asked for research that would enhance our understanding of the basic behavioral and social processes that influence the well-being of dogs. One of our special topics of interest was in the area of service dog well-being. We requested grants that would focus on the behavioral and psychological traits that enhance service dog performance and trainability, with the goal being to increase access of needy individuals to these dogs. We also asked that studies should be designed to include assessment of the health and well-being of service dogs themselves to ensure that these dogs would be functioning out of positive rather than negative motivation. Within the context of service dog behavioral health, we did receive a very exciting grant, 1995, Understanding the Flexibility and Limitations of How Dogs Acquire Knowledge and Understanding, Application to Service Dog Emotional Health and Selection. Now, some of you may know Dr. Brian Hare, who is the director of the Duke's Canine Cognition Center. He spoke at our conference. He is a co-investigator on this grant, and our principal investigator is Dr. Evan McLean, who works closely with Dr. Hare. And again, this is out of Duke University's Canine Cognition Center, and the grant was funded for $97,809. So the goal of Dr. McLean and Dr. Hare's study is to determine whether a dog's communicative abilities, memory, empathy for humans, or ability to independently solve problems predicts success as a service dog. And in order to answer this series of questions, they've designed a series of cognitive games that will be used to determine which dogs have the ability that predict their ability to help humans in specific service areas. As with all of our grants that we fund, we expect deliverables, tangible outcomes for every study that we fund. And in this study, the deliverables of the Canine Cognition Study will be to develop a new toolbox of cognitive tests that will allow rapid identification and training of the best dogs so that we can train these service dogs more efficiently, more effectively, and more cost effectively. Our goal is to increase the number of people assisted by our best friends and to ensure that we begin to take the steps to understand canine emotional health and well-being in the service dog selection process, but we also expect that this will have application across a wide range of veterinary medical areas.
For more information and to support these grants, please visit us online at www.akcchf.org/2014 grants.